Hello guys. So today we shall be discussing regarding the facial nerve. Okay. So we shall be mainly focusing on the facial nerve anatomy, in which we shall be discussing the course of facial nerve. Okay. How the facial nerve is passing, and through which foramens does it pass, how many branches does it give, right? So all the things I wanted to discuss it with you, and purely with the help of diagrams. Okay. So I have drawn here, I have drawn these pictures. I'll zoom into these pictures and then I will explain you complete facial nerve. And I'm telling you that this is really a difficult topic. The reason why it is a difficult thing is that there are many branches that take many turns. Okay. And there are many branches that join with other branches also. So anyways, you might already have studied facial nerve, right? Even if you're studying for the first time, so I have prepared lecture in such a way that even if you're studying for the first time, the concepts will be completely clear. So it might take a bit of time, maybe 20 minutes, 30, I don't know how many minutes the lecture is going to be, but this will be fruitful. Because why am I teaching facial nerve so detailedly is that next video will be on the lesions of facial nerve. To understand that, that will be a very short video, 10-15 minutes. Okay, to understand that, you have to understand this course. Okay, so facial nerve is very important for your exams, and especially in medicine, the neurology part, most of the stroke patients, they come with the facial nerve palsies. So you have to understand the facial nerve. Okay, let's get started right now. Okay, so very basic thing, let's start from the complete basic. Okay, instead of directly going to the nuclei, etc., let's start from the complete basic. So if you look at the facial nerve, all of you know facial nerve is your seventh pair of cranial nerve. That is why I'm not writing it. Okay, so facial nerve is your seventh pair of cranial nerve. So all of you know this particular point, right? Now, important thing you have to understand here is that, just look here, whenever we are discussing regarding the facial nerve, facial nerve is a mixed nerve. What do you mean by mixed nerve? It has got both sensory fibers, at the same time it has got motor fibers as well. Okay, so facial nerve has got both your motor fibers as well as sensory fibers. So there are two groups of fibers. Okay, one is motor, another one is sensory. So if there are two groups of fibers, then obviously nuclei also will be two groups. We have got motor nerve nuclei, we have got sensory nuclei also. So there are fibers that are exiting out of the motor nuclei, and there are fibers that are entering into the sensory nuclei, right? So we shall discuss what are those fibers. Guys, whenever you study the course, the first thing you will start with is some structure of brain and nuclei, and you see fibers running out of the nuclei. So that is what we are discussing right now here. Okay, so the first important thing is your motor. Okay, now if I have to discuss motor branches, first of all you should know how many motor nuclei does this particular part has. Okay, so there are two important motor nuclei. Where are these motor nuclei? I will show you in a minute. I'm just trying to explain you, brief up the things here. So facial nerve has got two motor nuclei. The first motor nuclei is called as facial nerve proper nucleus. फेशियल नर्व प्रॉपर न्यूक्लियस, ये कौन सा न्यूक्लियस है? ये मोटार नर्व का न्यूक्लियस. दिस इज अ मोटार न्यूक्लियस. ओके, नेक्स्ट इंपॉर्टेंट थिंग is superior salivatory or salivatory nucleus. How many nuclei we have got? Superior salivatory and facial nerve proper nucleus. ये कौन सा न्यूक्लियस? सेंसरी न्यूक्लियर की मोटार न्यूक्लियर? मोटार न्यूक्लियर. नाउ अभी यहां से जो फाइबर्स निकलेंगे फ्रॉम द फेशियल नर्व प्रॉपर न्यूक्लियस, जो भी फाइबर्स निकलेगा यहां से, these fibers are called as motor fibers. But what kind of motor fibers? They are called, if you look at the fibers that are coming out of this facial nerve proper nucleus, what are these fibers called as? These fibers obviously are called as motor fibers, but what is the other name here extra? You have to know it as somato motor fibers. So these fibers are your somato motor fibers. Then When it comes to the superior salivatory nucleus, even there are fibers that are coming out of the superior salivatory nucleus. These are also called motor fibers. But what motor fibers? They are parasympathetic motor fibers. They are parasympathetic motor fibers. They are parasympathetic motor fibers. So what are the two kinds of motor fibers we have got? One is somatomotor fibers coming from facial nerve proper nucleus, and second one is parasympathetic motor fibers that is coming from the superior salivatory nucleus. Ho gaya khatam. Okay, now once these motor fibers are done, now we shall go and discuss what are the sensory nuclei. And when it comes to the facial nerve, there is only one sensory nuclei into which the sensory fibers run. Okay, ये sensory nuclei का नाम होगा nucleus tractus solitarius. Nucleus tractus solitarius. So fibers will end here. और यहाँ से क्या, यहाँ पे क्या होगा मोटर में, यहाँ से शुरू हो जाएंगे fibers. Fibers will start from here and here fibers will end. So I will be repeatedly telling you these terms, guys. Keep this thing in mind again and again. I will be telling you repeatedly about facial nerve proper nucleus, superior salivatory nucleus and nucleus tractus solitarius. ठीक है, solitarius हो गया sensory, ये दोनों motor. Done. Now let us dive into the topic. But before I exactly tell you the parts, let me before I tell you the anatomy over here, let me tell you the names of these parts. Okay, let us first discuss this. So this part over here, you know this, but still I have to discuss it. So midbrain, this part over here is your midbrain. ठीक है, midbrain के नीचे क्या होगा? What is this part? This one over here is called as your pons. This is called as your pons. Next ये क्या होगा? Medulla oblongata. Okay, so this is your medulla. Why am I telling you? Because I want to stress at this point, pons और medulla के बीच में ये जो junction है ना, this is your pontomedullary junction. याद रखो, ठीक है, pontomedullary junction, very important. Pontomedullary junction is very, very, very important. Keep this thing in mind. Okay, so this is your pontomedullary junction. And what is this, guys? This is your fourth ventricle. Okay, this is your fourth ventricle. Okay, now why am I telling you these things? You will get to know in a minute, but just trust me. Okay, so these are the points which you have to remember over here. Clear? Now next important thing which you need to know, let us draw the nuclei as well. Okay, so I want you to take a screenshot of this because I'm rubbing this one now. Just take a screenshot of this, and now I will discuss the nuclei over here. Okay, so just concentrate on this now. Just look here. So if this part is your pons, if this is your pons, exactly look at this is called as your lower end of the pons. है कि नहीं? This is your lower end of the pons. Now why am I stressing is, from the lower end of the pons, at the lower end of the pons, there are two nuclei. Lower end of the pons mein there are two nuclei. What are those two nuclei? Those two nuclei I have already told you. One is facial nerve proper nucleus और दूसरा होगा superior salivatory nucleus. ठीक है, ये दो nuclei कहाँ पे है? They are located in the lower end of your pons. So let me draw those nuclei as well. ये देखो, this one which I am drawing with red over here, this is your facial nerve proper nuclei, and the one which I am drawing with the pink over here is your superior salivatory nuclei. ठीक है, finish, right? Now another important thing is that if you concentrate here, this here you have got sixth pair of cranial nerve. ठीक है, now let me draw the fibers. The first fiber which I will draw is from the facial nerve proper nucleus. Okay, from the facial nerve proper nucleus. So from the facial nerve proper nucleus, you see a motor fiber is exiting, but how is it exiting? It is going behind, making a turn around your sixth pair of cranial nerve, coming down and exiting through what? Pontomedullary junction. You see this? So let me write down over here. This red one over here is your facial nerve proper nucleus. Okay, and next the pink one over here is your superior salivatory nucleus. Superior salivatory nucleus. So we have got facial nerve proper nucleus and superior salivatory nucleus. How is the facial? How are the motor fibers of what kind of motor? Somatomotor, right? So how are these motor fibers exiting out? They are exiting out. First, they are making a turn around the, what is this, sixth pair of cranial nerve, and then they are coming out of your pontomedullary junction. Now, why is it so important? Why is it so important is that as it is making a turn, अभी ये जो line है ना यहाँ पे, this is your roof of your fourth ventricle. I'm sorry, this is the floor of your fourth ventricle. So what is exactly happening over here is that exactly at this part, as it is making a turn, there is also a bumpy elevation. This bumpy elevation you call it as facial colliculus. ठीक है, ये bumpy elevation का नाम क्या होगा guys? What is the name of this particular bumpy elevation? This is called as facial colliculus. Facial colliculus. Okay, so this is the first part which I want you to know. ठीक है, okay. The next important thing, what is the use of this kind of motor fiber and all, I will tell you in a minute, but before that let me draw another important thing. Okay, so what was this pink color one? This is your superior salivatory nucleus, right? Now what happens from this? What happens is that fibers from the superior salivatory also exit through the pontomedullary junction. They exit through the pontomedullary junction like this. Okay, now let me draw another important thing over here. Let us say this is your tongue. ठीक है, अभी ये anterior two-third region जो है ना, this anterior two-third of the tongue, anterior two-third of the tongue, यहाँ से जो taste sensations, whatever taste sensations we have got over here, whatever taste sensations we can perceive over here, right? So all these taste sensations from the anterior two-third of the tongue, they are taken, see, any sensation is taken out by which nerve guys? Obviously they are taken out by the sensory nerve, right? So taste sensations from the anterior two-third of the tongue are taken up by the sensory nerve. Now this sensory nerve comes all the way and enters into your medulla. Why? Because within your medulla you have got a nuclei. What is that nuclei of sensory nerve? बताओ, sensory nerve का nucleus कौन सा है? What is that? Nucleus of tractus solitarius. Okay, so I'm just writing here as nucleus tractus solitarius, NTS. Okay, so finally they are entering into this nucleus tractus solitarius. Okay, can anyone tell what might be the name of this sensory nerve which is taking taste sensation from anterior two-third of the tongue all the way up into the medulla, and they are entering inside this NTS nucleus? What is the name of this particular nerve over here, guys? If you have guessed it, then it might be right. This is your cauda tympani. If it is getting a bit hectic, then just leave this word. Okay, when I'll come back, when I'll teach the remaining part, you'll understand it. Okay, now why am I telling you these things? Because I already told you 3 nuclei है, उसमें से 2 मोटर हो गया और एक सेंसरी हो गया. मोटर न्यूक्लियस में ये रेड वाला जो मोटर न्यूक्लियस है, what has it done? It has taken a turn behind, creating facial colliculus, and it has come out of pontomedullary junction. Khatam. Second, from superior salivatory nucleus also, from pontomedullary junction, it has exited out. Both of them, where are they present? They are present in the lower end of the pons. Finish. Next we have got nucleus tractus solitarius in the medulla, और वहां पे कौन सा sensations आ रहे हैं? Taste sensations from the anterior two-third of the tongue. Guys, not only taste sensations, even pain, touch, right, temperature, ये sensations भी you can perceive within that nucleus. ठीक है, from other fibers, pain sensation, touch sensation, temperature sensation, that also you will be perceiving here. Okay, those sensations also will enter here. Okay, abhi taste sensation matlab not only from anterior two-third, posterior one-third of the tongue se bhi there are taste sensations. So from the posterior one-third of the tongue, taste sensations are carried to this nucleus with the help of your glossopharyngeal nerve. You're clear? I've just told you one point out of many points that anterior two-third of the tongue से chorda tympani लेके जाएगा कौन सा sensations, taste sensations to nucleus tractus alterius. But not only chorda tympani, even your sometimes vagus nerve also, a part of vagus nerve, glossopharyngeal nerve also takes the sensations. Not might be from the anterior part, but from the posterior part of posterior one third of your tongue. It is not important to know right now. Okay. So I was discussing over here regarding this motor nerve, है ना? ये motor nerve का नाम क्या है? What is this? Facial. It is coming from facial nerve proper nucleus, है ना? What is the function of this? I'm just briefing up the things now. I'm not going into details. Okay. So what is the function of this? Is that this is the motor nerve which supplies to the muscles of your facial expression. Okay. This supplies to muscles of facial expression. Supplies to muscles of your facial expression. Okay. And the next important thing, pink one. What is this pink one? This is your superior salivatory nucleus. और यहाँ से जो motor fibers are, what motor fibers you call it as? Parasympathetic motor fibers. I already told you, right? Now what will this do? This does the parasympathetic function. Parasympathetic मतलब कौन सा function हो सकता है guys? There are two important functions over here. एक हो गया, one is lacrimation, tears, and the other one is your salivation. So what are the two important things? One is your lacrimation and the other one is your salivation. Now how do these fibers innervate? How do these fibers they branch? How do these fibers pass? And finally they cause lacrimation, salivation, and cause contraction of, I mean, the muscles of facial. How do they innervate the muscles of facial expression? And how are the taste sensations carrying out? Everything we will discuss in detail step by step. So this is the basis for what I'm going to teach you right now. Okay. So the next important thing which I wanted to tell you is this one. Now once you are clear with this, now let us dive into the topic. Now, as you can see here, let me first draw the anatomy. Okay, so let me just write down the parts over here so that you'll understand. Just have a bird view of this before I write down all the parts. These are all the parts. Okay, so now let me zoom into this. All of you know this is orbit. I'm not writing it. Okay, but this one over here is your lacrimal gland. What is this? This is your lacrimal gland, and I also want you to take a screenshot at the end. Okay, and here we have got anterior cranial fossa, और ये हो गया middle cranial fossa, और ये हो गया posterior cranial fossa. Clear? Now within this, what is this bone over here? This is your maxilla. ठीक है? This is your maxilla, and all of you know behind the maxilla here you have got a plate. Guys, tell me what is this plate? This plate is called as your pterygoid plate. This is called as your pterygoid plate. ठीक है? और ये maxilla और pterygoid plate के बीच में, ये देखो ये maxilla हो गया and this is pterygoid plate. So between the maxilla and pterygoid plate, this space whatever you can see over here, this is called as pterygopalatine fossa. Okay, so what is this particular area called as? This one is called as pterygopalatine fossa. So this is your pterygopalatine fossa over here. Now after this guys, what are these three openings over here? These are three foramens. Okay, so here you have got foramen lacerum. ऐसे याद रखो, this is L shape. So foramen lacerum, this is foramen rotundum, and this is foramen ovale. So let me write it down. This is your foramen lacerum, foramen rotundum, foramen ovale. ठीक है, बस यहां तक याद रखो. ठीक है. Now let us go back here. When you go back, look at this. What is this part? This one over here is your middle ear. All of you know, है ना? This is your middle ear. और ये वाला कौन? ये वाला part. What is this part over here? Yeah. What is this part? This is your internal. This is your internal acoustic canal, right? This is your internal acoustic canal. And if you look here, this green shade, whatever I have done, this is, what is this? This is your anterior wall. ये वाला जो green shade है ना, this is your anterior wall of your middle ear. और ये वाला जो शेड है ना, दिस इज योर पोस्टीरियर वॉल ऑफ द मिडिल ईयर, ओके। और नीचे जो येलो कलर है ना, दिस इज योर फ्लोर, रूफ निकाल दिया मैंने, एंड दिस व्हाइट कलर वन इज योर मीडियल वॉल, ठीक है। और यहाँ पे जो लैटरल वॉल होना था, आई हैव रिमूव्ड दैट लैटरल वॉल आल्सो, सो आई हैव रिमूव्ड द रूफ, आई हैव रिमूव्ड द लैटरल वॉल, so that you can see the contents inside, okay. So let me write it down. This is your this is your anterior wall, this is your anterior wall, this is your posterior wall, और roof हो गया, this is your medial wall, and this is your floor, this is your floor over here, okay. So these are the important things which you need to know. Now apart from this, what you need to know, what is this part over here, this is your mastoid bone, ये वाला जो bone है ना यहाँ पे, this is your mastoid bone over here, mastoid bone, and near the mastoid bone if I draw a process over here, that is your styloid process, okay. And between the mastoid bone and styloid process, you see a foramen over here, foramen between your styloid process and mastoid, this is called as stylomastoid foramen, stylomastoid foramen. You might be thinking, अबे पता है ये सब क्यों बता रहे हो? Why am I telling you is, at every level there is a facial nerve injury. Sometimes they will tell you facial nerve injury at the level of stylomastoid foramen, what will be the clinical manifestations, so you have to know individual parts. Or in few minutes I'll also tell you there are nerves that are exiting out of this stylomastoid foramen, you should know what are these nerves. So that is why I'm just preparing you the anatomy, okay. So step by step I'm teaching you, this is the main reason for that. So we are done, we have discussed enough anatomy over here. Lacrimal हो गया, pterygopalatine fossa, you understood maxilla, pterygoid plate, ये वाला part थोड़ा ज़्यादा concentrate करना, because this is the part where most of the nerves enter and exit, ठीक है. Mastoid, stylomastoid foramen and styloid process, okay. So till here I hope everyone is clear, okay. Now after this, the next important part which we shall be discussing, अभी यहाँ पे ना there are two important dots which you can see, ये देखो, there is one dot in this fossa, pterygopalatine fossa, okay. pterygopalatine fossa में जो ganglion दिख रहा है यहाँ पे, what is this ganglion? Pterygopalatine ganglion, right. So what is this ganglion over here? I'm just writing it as PPG, okay. PPG मतलब pterygopalatine ganglion. अभी यहाँ पे जो ganglion है, all of you just look here, there is a ganglion at the turning point में एक ganglion दिख रहा है ना यहाँ पे, this ganglion which is at the turning is called as geniculate. ये तो मोटा हो गया, okay. So this is geniculate, this is your geniculate ganglion. What is this? This is your geniculate ganglion. What do you mean by genu? Genu मतलब bend, ठीक है, जहां पे bend है वहां पे ये ganglion है, so you call it as geniculate ganglion. So I hope this is basically clear to all of you, right? Now, once after discussing the anatomy, take a break. So we were discussing regarding this particular part, okay. We were discussing what did we discuss? We discussed the basic anatomy over here, internal acoustic, medial, floor, anterior and posterior here, right. And I hope all of you know this is your internal carotid artery, okay. Now next important thing, one thing I just forgot to tell you over here, अभी यहाँ पे guys you see a canal over here, है ना. This canal over here is called as your pterygoid canal, ठीक है, याद रखो बस, okay. I'm not writing it, ये canal का नाम है pterygoid canal, okay. What is this? Pterygoid canal. If you want, you write it in your notes, okay. Anyways, I'll write it in the next picture. So now first what we shall discuss, first step by step, we first discuss this red color fiber. red color fiber कौन सा है? motor fiber. What is that? Coming from facial nerve proper nucleus. First we will discuss that, then next we will discuss the remaining fibers as well, okay. So first let us discuss about the course of the somatomotor fiber. Now If I zoom into this, from where is that somatomotor fiber coming out? Okay, guys, before that I just wanted to tell you one more important thing which I missed. I'm really sorry, I missed one thing, that यहाँ पे ना I told you this is superior salivatory nucleus and this is your chorda tympani, right? Now both of them are enclosed in one of the component. Both of them are enclosed in the component of facial nerve, and this one over here is called as your nervus intermedius. This part over here is called as your nervus intermedius. Now if they ask you within this nervus intermedius what do you basically have, ये देखो, you have got one pink wala and one green wala. What is that pink wala? That is parasympathetic motor fiber. And what is this green? This is your sensory fiber. One motor and one sensory, both of them are located in nervus intermedius. Okay, just remember this. Now let us go back. Yeah, so what I was discussing, first we will discuss about the red wala. What is that red color one? Called as your motor, somatomotor fiber. Okay, so this is your from the floor of or the lower part of the pons, you have got this particular nucleus. Okay, this is facial nerve proper nucleus. From here it will take a turn. I told you क्यों? क्योंकि यहाँ पे sixth nerve होगा, right? It will take a turn and come back like this through what? Through pontomedullary junction. So from the pontomedullary junction it has taken an exit, and where is it entering right now? Just look here, where is it entering right now? It is entering into your internal acoustic canal, right? So this particular one is entering into your internal acoustic canal, and it is coming all the way down, passing through this canal. And just look here, and now I am zooming it. It is entering into a ganglion. ये ganglion का नाम क्या है guys? What was the name of this ganglion? I told you this is your geniculate ganglion. I want you to just take a screenshot of this, put it in front of you in an iPad or whatever it is, right? And just watch my lecture looking at this picture. So just take a screenshot of this. Yeah. Now let me go back. So this particular nerve is coming all the way down, okay, passing through this canal and entering into your geniculate ganglion. Now once it has entered into the geniculate ganglion, it will relay in this geniculate ganglion. Once it will relay into this geniculate ganglion, from here you have got postganglionic fibers, right? Now this postganglionic fibers, what will happen? This will go posteriorly backward. Just look here. It will go posteriorly backward. कहाँ पे जा रही है? It is going all the way to the posterior wall. And then on the posterior wall, it will descend down like this. It will descend down, and finally it is entering into a foramen. ये foramen का नाम बताओ अभी. This foramen is called as your stylomastoid foramen, right? Now this will come out of this stylomastoid foramen. Fine. Now what is the big deal here? Big deal ये है कि as this motor nerve of the facial nerve, right? As this is a motor fiber of the facial nerve, as it is coming downward, पता है ये क्या करेगा? This will give a branch like this. Branch to what? Branch to a muscle called as stapedius. I'm not drawing the stapedius muscle. Okay, for your sake I will draw it. ये देखो. Let us say this is a representation of a muscle. ठीक है? So it is branching what? It is branching your stapedius muscle, and this nerve is called as a stapedial nerve. Okay, I will write down later. Stapedial nerve. After giving the stapedial nerve, it will come down all the way, come down, and finally it will give branches here. How many branches? 3 branches. How do you remember these branches? Remember it with the mnemonic PAPS. P-A-P-S. Okay, so what are these branches? Let us look into it. The first branch is your posterior auricular branch. First branch is your posterior auricular branch. And the second branch over here is nerve to posterior belly of digastric. Nerve to posterior belly of digastric muscle. Okay, and third one is your nerve to stylohyoid muscle. Third one is your nerve to stylohyoid muscle. Okay, so what did it do? Facial nerve came all the way down through the foramen. It has given three branches. They are named as PAPs. ये देखो, PAPS. What is PAPS? Posterior auricular, posterior belly of digastric and nerve to stylohyoid muscle. हो गया, right? It has given these branches. After giving these branches, what will happen is that this nerve comes all the way down like this. It will continue होने के बाद क्या करेगा, यहाँ पे we have got a gland. What is that gland? Parotid gland. Does this nerve supply the parotid gland? No. It will pass through the parotid gland. Okay? It will pass through the parotid gland and it will give how many branches? 1, 2, 3, 4 and 5 branches. What are these 5 branches? एक हो गया, ये वाला पिक्चर जो फेमस है ना, फेसबुक, इंस्टा, एवरीवेयर यू सी दिस पिक्चर, राइट? व्हाट वाज दिस पिक्चर अबाउट? सो इट गिव्स ए फ्रंटल, it gives a temporal branch, and next is it gives a zygomatic branch. Temporal ho gaya, zygomatic. It gives a buccal branch. It gives a mandibular branch, that is your marginal mandibular, and next it gives your cervical branch. So all these branches, what do they do, guys? They supply your muscles of facial expression. Okay, so they supply to your muscles of facial expression. If you remember in the starting I told you facial expression, if you remember in the starting I told you that, just look at this, I told you this red color fiber gives innervation to the muscles of facial expression. So this is how it gives, guys. Once again, very fastly, let us discuss this facial nerve. Okay, so this nucleus is called as proper nucleus of the facial nerve. This will take a turn around what? Around the 6th pair of cranial nerve, exit out through the pontomedullary junction, and then it will enter into your internal acoustic canal, and next it will relay on which ganglion? Geniculate ganglion. और वहाँ से पोस्ट गैंग्लियोनिक फाइबर्स जो है, दे गो पोस्टीरियरली बैकवर्ड, डिसेंड डाउन, they come out of a foramen called as stylomastoid foramen, and it gives PAPS branches. After giving PAPS, it will pass through this particular gland. This is called as your parotid gland. ठीक है, उसके बाद क्या होगा ये? It will give these 5 branches. Okay, खत्म. This is all you need to know regarding the motor part. We have discussed regarding the motor part. Okay, after the motor part, the next fiber which we shall discuss in the list में कौन सा है यहाँ पे? We discussed about this one, red one. ठीक है, now we will discuss about this pink one. What is this pink one? Is your superior salivatory nucleus. ठीक है, so let us look at this superior salivatory nucleus. Guys, again I'm not drawing the nucleus here और यहाँ से exit लेगा. I'm directly drawing the branches over here. Okay, so this pink one, ये देखो, ये पिंक वाला जो है ना, this is your superior salivatory nucleus. देखो अच्छे से देखो, this pink one is coming all the way down, and same like the motor fiber, will this superior salivatory fiber relay here? They do not relay. बस it will pass through the ganglion, बस ऐसे pass करेगा, but it will not relay here. Okay, now after passing through the ganglion, this superior salivatory nucleus का जो fiber है ना, parasympathetic fiber, this will divide into 2 branches. मैंने क्या कहा था पहले? I've told you something in the starting. You remember this? What did I tell you? That this pink one will help in lacrimation and salivation. मतलब वो 2 fibers क्या है? What are those 2 fibers? One are lacrimal fibers, another one is salivatory fibers. ये देखो, I'm zooming it here, just look at this. Right, so 2 fibers. See, ये वाला जो fiber है ना, this particular fiber is your salivatory fiber, और जो fiber ऐसे ऊपर जा रहे हैं ना, this particular fiber is your lacrimal fiber. Okay, so very easy and very clean. It has come out of this pontomedullary junction, went into geniculate ganglion. It did not relay there. ठीक है, वहाँ पे synapse नहीं हुआ. Okay, it did not synapse there. Directly divided into two fibers. One fiber which is going up is your lacrimal fiber, और दूसरा fiber जो नीचे है यहाँ पे, this is your salivary fiber. Okay, now by the way, are these sympathetic or parasympathetic? Again I'm reminding you the same thing, it is parasympathetic. Okay, now this lacrimal fiber will enter, this lacrimal fiber will enter into this particular opening over here. अब ये बताओ ये opening का नाम क्या है? What is this which is in L shape? This is your foramen lacerum. Okay, just look here. Now this one is going to enter into your foramen lacerum, और वहाँ से it will enter into a canal called as pterygoid canal. I already told you, right? And now it will enter into this particular ganglion. What is this ganglion? Pterygopalatine ganglion. See, if you are not understanding the way I am teaching you, that is the reason why I told you to take a screenshot of the parts here which I have already written. Okay, so that would be helpful. So go back, take the screenshot of that, keep it in front and just look at whatever I'm teaching. Okay, because if I write down all the parts here, it will be kind of mess here. I don't want to create anything. So these parasympathetic lacrimal fibers are entering into this pterygoid canal, and finally they are relaying on the pterygopalatine ganglion. Now after that, from here the postganglionic fibers also will come. So these postganglionic fibers are coming like this. Let us stop this story here. Okay, let us stop the story here. Now focus on this part, internal carotid artery. Now surrounding this internal carotid artery, you have got fibers. This is your sympathetic fiber. Okay, abhi ye sympathetic fiber will also, along with lacrimal fiber, sympathetic fiber also enter into your pterygoid canal. ठीक है, enter कर लिया, but it will not undergo any kind of synapse here. ठीक है, now the names will be changed here. You know what are these names? This lacrimal fiber, now you can call this lacrimal fiber now as greater petrosal nerve. Okay, and this sympathetic fiber which is in the pterygoid canal, this one is called as deep petrosal nerve. एक हो गया greater petrosal nerve, and now this one is your deep petrosal nerve. अभी ये greater and deep petrosal nerve, both of them are in which canal? बताओ, greater petrosal nerve plus deep petrosal nerve, both of them are in which canal, guys? Both of them are in your pterygoid canal. अभी ये दोनों को मिला के you call them as a single nerve. That nerve is called as VDN nerve. मतलब GPN and DPN together are called as VDN nerve. और दूसरा नाम पता क्या है? You can also call it as nerve to pterygoid canal or VDN nerve. VDN nerve मतलब क्या? GPN plus DPN. Okay, so till here I hope you understood it well. Yeah, right. Now we discussed about this particular nerve over here. Remember this, in the next picture also I will talk about this. Okay, this is your greater petrosal nerve, which are containing what fibers? Your lacrimal fibers. Okay, अब ये देखो, ये preganglionic lacrimal fiber है. Pterygopalatine ganglion क्रॉस करने के बाद, after crossing this pterygopalatine ganglion, after synapsing, you call this as postganglionic fiber. The name is same, postganglionic lacrimal fiber. Okay, the same postganglionic lacrimal fiber, just look here. ये देखो, this is your postganglionic lacrimal fiber, है ना? Remember this. Okay, I will just write it as postganglionic lacrimal fibers, postganglionic lacrimal fibers, right? So what is this third picture about? Third picture is about, we were discussing the course of lacrimal and salivary fibers. उसमें से lacrimal I just now discussed. ठीक है, now I will discuss about the salivary fibers. First what we discussed? Motor. मोटार में द मेन रेड कलर वन वी हैव डिस्कस. उसके बाद पिंक में 2 ब्रांचेस है. एक हो गया लैक्रिमल एंड अदर वन इज सलाइवरी. लैक्रिमल इज डन. नाउ वी विल डिस्कस सलाइवरी. नाउ just look here. What did I tell you? Just remind me, what did I tell you? I told you that ये जो parasympathetic fiber है coming from superior salivatory nucleus coming into the geniculate ganglion, it is not relapsing, I mean it is not relying or synapsing here, rather it is dividing into 2 branches. I told you एक branch जो ऊपर गया वो कौन सा है? What is that? That is your lacrimal. And now look here. Now the next branch which is coming down like this is your salivary branch. Let me write it down for you. So ये वाला जो branch है, this is your salivary fiber. कौन सा salivary fiber? Parasympathetic salivary fiber. Motor or sensory? Motor. Now look here, what is going to happen? Just look here. Now this particular fiber will come backside like this along with the motor nerve, right? Along with the facial nerve, and then it will descend down along with the facial nerve, but in between the course itself, abruptly it will enter into the middle ear, right? Into the open space of the middle ear, it will travel like this, and then there is a fissure here. There is a small fissure here. I can't remove this. Okay, there is a small fissure here. This is called as pterygotympanic fissure. Through this pterygotympanic fissure, this particular salivary fiber comes out. Okay, this particular salivary fiber comes out. And when it comes out, where does this go? This salivary fiber comes down all the way, right? It comes down all the way. And mandible में जो ganglion है, what is that ganglion called as? Submandibular ganglion. Let me write it down. This one over here is your submandibular ganglion. Submandibular ganglion. So this fiber, salivatory fiber, will synapse in this submandibular ganglion. Synapse करने के बाद यहाँ से क्या निकलेगा? Postganglionic salivary fibers. These postganglionic salivary fibers, one will enter below the tongue, one will enter below the mandible. अब बताओ, below the tongue and below the mandible मतलब one is sublingual gland, another one is your MND मतलब mandibular gland, submandibular gland. हो गया? Now you understood how this salivary part comes down, supplies your sublingual, submandibular, and the lacrimal part goes up and supplies your lacrimal gland. Listen, I did not tell yet how it is going and supplying the lacrimal gland. I will tell you in a minute. Okay, but for now you understood that this branch comes all the way, enters into your geniculate ganglion, वहाँ पे divide होगा, एक नीचे रह जाएगा यहाँ पे ऐसे, and other one goes up, enters into a foramen called foramen lacerum, then it will synapse in this pterygopalatine ganglion, and this particular fiber is your postganglionic lacrimal fiber. Okay, and this one I'm not going to repeat it again, but you understood this. Clear? Yeah. Okay, now where I have to start? खुद भूल गया है. Yeah. So look here. Let us say in this entire picture, let us say there is a ganglion called trigeminal ganglion. Okay, I know this is not the correct position to put trigeminal ganglion, but still something is better than nothing. So I don't have any place here. So this is your trigeminal ganglion. Okay, now trigeminal ganglion say how many fibers will come out? 3 fibers, you know. One is ophthalmic, maxillary, and mandibular. V1, V2, V3. Okay, so I'm drawing green color for ophthalmic branch. Okay, next I will draw pink for mandibular branch. Okay, pink for mandibular maxillary branch, and then I will draw blue for what is this? Mandibular branch. मैंडिबुलर ब्रांच, ठीक है, V1 V2 V3। अभी ऑप्थैल्मिक का क्या सीन है? नाउ दिस पर्टिकुलर ऑप्थैल्मिक ब्रांच कम्स ऑल द वे डाउन एंड एंटर्स थ्रू द सुपीरियर ऑर्बिटल फिशर, ठीक है, it enters all the way through the superior orbital fissure and divides into three branches, 1 2 and 3. So what are those three branches? The first branch is called as your nasociliary branch. सेकेंड ब्रांच इज कॉल्ड एज योर फ्रंटल ब्रांच, क्योंकि ये फ्रंटल रीजन है ना। थर्ड पार्ट इज कॉल्ड एज योर लैक्रिमल ब्रांच। अभी लैक्रिमल ब्रांच मतलब डायरेक्टली इट गोज एंड एंटर्स इनटू योर लैक्रिमल ग्लैंड, हो गया, राइट। नाउ नेक्स्ट इंपॉर्टेंट थिंग, द नेक्स्ट नाउ वी शैल बी डिस्कसिंग इज मैक्सिलरी। Okay, maxillary will enter through what foramen is this? I told you to take a screenshot. What is this? Foramen rotundum. So it will enter through the foramen rotundum like this, and it will pass forward like this, ठीक है। As it is passing forward, यहाँ से एक छोटा सा branch मिलेगा आपको, that is your zygomatic branch. Now understand this thing clearly. Okay, maxillary now entered, एक ब्रांच दिया zygomatic branch. Now I told you we have got post ganglionic lacrimal fibers. ये देखो ये वाला post ganglionic lacrimal fibers है ना। Now this post ganglionic lacrimal fibers, just look here, ये post ganglionic lacrimal fibers along with the zygomatic branch they travel together. Okay, they travel together, but who is the one that is finally reaching your lacrimal gland? That is your post ganglionic lacrimal fibers. So what you need to know here is that ophthalmic branch का third part whatever is there, ophthalmic nerve का third branch जो है ना, that is lacrimal, entering into lacrimal gland. Next is your parasympathetic lacrimal gland. Your parasympathetic fiber is also innervating your lacrimal gland. वो parasympathetic fiber कौन सा है? What is that? That is your post ganglionic lacrimal fibers. Okay, so this is also entering into your lacrimal gland. Okay, so now we are officially done with the lacrimal part and we are done with the salivary part also. मतलब we are actually done with the second part here. What is the second part? Superior salivatory nucleus भी खत्म. We already discussed facial nucleus. Okay, so क्या है, what are the things? See, we discussed this facial proper nucleus का branches we discussed the second one branches also. Now we are left over with the sensory. Let us see from which parts the sensations are taking up all the way to the nucleus tractus solitarius. Okay, वो insta वाला sensations नहीं, this is the real sensations, ठीक है। So all of you just look here. Now let me use the black itself because I have used all the colors over here, right? So the next important thing over here which I have to discuss is the next important branch is, what did I tell you in this? I think I have discussed this already. Anterior 2/3 of your tongue, वहाँ से taste sensations कौन लेके जाएगा? What is that? Chorda tympani. Very good. ये देखो, chorda tympani from the anterior 2/3 of the tongue, it will take taste sensation like this, right? Initially chorda tympani देखो, initially chorda tympani is going like this, right? And now chorda tympani enters through this particular pterygotympanic fissure, passes along your two nerves. What are those two nerves? Passes along your salivary fiber and the facial nerve, ठीक है। So it passes along with that and enters into geniculate ganglion. I can't zoom here guys, अगर zoom भी किया you won't understand here, but just remember that chorda tympani is entering into your geniculate ganglion. geniculate ganglion enter करने के बाद वहाँ से जो fibers है ना, from there whatever fibers are coming out, ये देखो, the fibers are coming out like this, they're coming out and they're finally entering into your NTS. This is all you need to remember. Okay, anyways, just remember anterior 2/3 taste sensations are entering into NTS. How are they going, how many lefts and rights they are taking is not important, क्योंकि when I discuss the clinical part, right, lesions of facial nerve, ये important नहीं है कि nerve कैसे जा रहा है, how many turns it has taken and all, that's not that important, ये बस बकचोदी है. So anyways, this is not important. What is important is, I'll tell you at the end. But for now, just remember that from the anterior two-third, taste sensations are taken back to NTS. Okay, NTS. So this is all you need to remember over here. Okay. So sir, you did not discuss about mandibular nerve. It's not important. When I will discuss about trigeminal thing, I will discuss. अभी यहाँ पे mandibular nerve का role क्या है? Very easy, guys. This mandibular nerve, you know, passes through this foramen ovale, है ना? ये देखो, passes through foramen ovale. But after passing, it will give another branch like this. ये पता branch का नाम क्या है? This is your lingual nerve. ये lingual nerve passes along the chorda tympani and supplies to your tongue. ठीक है, this is not important right now. We will discuss these things later on. Okay, but for now, regarding the facial nerve, these are the important things which you have to discuss. So let us quickly revise whatever we have discussed over here. So first we discussed is how the nerve, where are the nuclei. First of all, what are the nuclei? Sensory हो गया, motor हो गया, mixed nerve. Motor 2 nuclei. Facial nerve proper nucleus or superior salivatory nucleus. Sensory में nucleus tractus solitarius. Okay, both of them are motor here. One is called somatomotor and the one is parasympathetic. Now the red one is making a turn around the sixth cranial nerve. It is creating a bumpy like elevation in the floor of fourth ventricle, and this is called facial colliculus, or this will innervate muscles of facial expression. And second one, salivatory nucleus, right? Superior salivatory nucleus, यहाँ से भी fibers जो निकल रहे, these are parasympathetic. And next you have got the sensory, both of them are in a single element here. This is called as a nervus intermedius, and the pink one is responsible for lacrimation, salivation. And next, taste sensations from the anterior two-third are taken by chorda tympani. Okay, even from posterior one-third they are taken by glossopharyngeal. It is not important in this particular topic over here. Okay, so I hope whatever I have discussed so far is clear to you. If you didn't understand, है ना, message करो मुझे, you message me. Okay, I'll make you understand here. Clear? Don't ask me, sir, explain the topic once again in the message. Okay, so just ask me whatever doubts you have got over here. And again, I'm telling you, I've given my number in the last class also. But anyways, okay. So when I give the number, students, what I expect is they message me, hi sir, how are you, I need notes, I have doubts. ऐसे नहीं, सीधा वीडियो कॉल, और वो भी रात 2 बजे 3 बजे you think I'll be round the clock all the time lifting the calls? Of course, 2, 3 o'clock, 1 o'clock, 2, I might be at the clinic. Even right now I'm sitting at the clinic, right? I might be at the clinic. सीधा वीडियो कॉल, सीधा कॉल. Some of them are directly messaging notes. कौन सा notes? Which notes you want? You want Bhagavad Gita? You want Quran, Bible? What notes you want? You want my notes? You have to message. Okay? So this is the basic protocol which you have to follow, right? So this is all you need to know, guys. Now we shall be discussing regarding the facial nerve lesions. Okay? So again, I'm telling you guys, if you are watching this video directly, the facial nerve lesions, I suggest you not to watch it, because you won't understand anything. Basically, you will understand only when you watch this particular video. Look at this. So in this video, I have discussed about the courses of facial nerve, how the facial nerve is passing step by step. Okay, right from the beginning, step by step, I have discussed everything over here, as you can see. Okay, if you understand this, only then the facial nerve lesions are very, very easy to understand it. Okay, till then you won't understand it. Again, I'm telling you, go back, watch that, and then come back here. Okay, now before I discuss the facial nerve lesion, let me draw the cortex. Let me draw the cortex over here. Right, so if let us say this is a cortex, which doesn't look like that, but still it is a cortex, and this is your pons. Okay, this is your pons. Why are you drawing pons over here? Because I told you in the previous lecture that the nuclei of the seventh pair of cranial nerve are located within your pons. Okay, so let us say this is your right side, this is your left side, right cerebral hemisphere, left cerebral hemisphere. Okay, and in the same way, this is the right side, left side. What we do is that for our easy understanding purpose, we will divide the face into right half, left half, and we'll also divide it into upper half and lower half. upper half and lower half. Okay, now understand one thing, that in the previous lecture I told you that there is a motor nucleus called as, what is that? Facial nerve proper nucleus, right? Facial nerve proper nucleus, that is a motor nucleus, and that motor nucleus supplies to your muscles of facial expression. Also I have taught you how, right? So I'm drawing that motor nucleus over here. So this is that particular motor nucleus over here. Okay, now what I'm telling you is, this motor nucleus has got two parts. Okay, this is called as a upper part, lower part. Here also upper part and lower part. One basic rule you have to remember is, upper part of the motor nucleus supplies to your upper part of the face. Lower part of the motor nucleus supplies to your lower part of the face. Very easy, right? So what did I tell you? The upper part will give innervation to the upper part of the face. Okay, the lower part will give innervation to the muscles of the lower part of the face. Okay, so first let us write down, let us satisfy these statements. Okay, so let me write it down. What did I tell you? The lower part supplies to innervates the lower part of the face. Okay, the lower part of the motor nucleus. Again I am writing here, this is the motor nucleus. What motor nucleus? Facial nerve motor nucleus. That is your proper nucleus, hai na? Right, and see, the lower part supplies to your lower part of your face. And what did I tell you? Upper part will supply your upper region, right? Upper part will supply your upper region. So let us draw here. Ye dekho, upper part of the nucleus will supply, innervate your upper part like this. Okay, ठीक है. So this is all fine, but who is activating these? Who is activating these neurons? These neurons are activated by some other neurons which are located above, right? So those are called as upper motor neurons. ठीक है, ये न्यूक्लियस के नीचे जितने भी न्यूरॉन्स है, see whatever neurons are located, what are these neurons? These are all lower motor neurons. अभी इसके ऊपर जो neurons मैं draw करूँगा, whatever neurons I draw here, these are upper motor neurons. ठीक है, now this is all clear to you. Now upper motor neurons, how are they innervating the lower motor neurons? How are they relapsing the lower motor neurons? We will see. Okay, so just have a look over here. First let us discuss about the lower upper part. Let us discuss about the upper part. See, upper part, the neurons are ipsilateral. Okay, the upper part, the neurons come from the same side and the opposite side as well. So you will completely understand when I'll write it down. Just listen to whatever I'm telling you. Okay, so neurons from left side are coming and innervating here. Neurons from right side are also coming and innervating here. The same thing goes on to the other side. I don't want to draw in and make it a mess. Okay, what about the lower part? When it comes to the lower part receives neurons only from the opposite side. Okay, again I am making it clear, just look here. Okay, upper part hai na, upper part is receiving from same side, opposite side. Yahan pe bhi upper part will receive from same side, opposite side. Okay, but whereas lower part is not receiving from the same side, it is receiving only from the opposite side. Okay, now how do you apply this? How do I apply this is that, abhi ye facial nerve lesions mein na, usually we divide these facial nerve lesions into two parts. Okay, what are those two parts? One is supranuclear lesion और दूसरा हो गया infranuclear lesion. Supranuclear lesion and infranuclear lesion. What do you mean by that? What do I mean by that is, ये देखो, ये motor nucleus है ना, above the motor nucleus अगर injury हुआ, then that is called as supranuclear lesion. अगर motor nucleus के नीचे यहाँ पे कहीं पे भी injury हुआ, this is called infranuclear lesion. Clear? Now we will discuss about supra, उसके बाद we will discuss about infra. Now in supra, For example, let us say I am right side I'm cutting this part. Okay, when I'm cutting this part on the right side, now you tell me what is going to happen. First, let us look at the blue fiber. If I'm cutting on the right side, blue fiber is going on to the left. Left में कहाँ पे? It is going on to the left side lower part. मतलब, so this part will be affected. This part will be paralyzed. ठीक है? Next important thing, the pink fiber is also affected, obviously, but this pink fiber usually is going to the upper part, so upper part also should be affected, but it won't be affected. Why? क्योंकि अगर ये एक pink line तो गया, right? But for compensating it, there is another pink line over here, so that line will compensate this line. So as a result, upper part is not affected. Okay, the same thing goes with the other side also. Even on the other side also, if there is a lesion, then the contralateral side will be affected. Okay, so I hope you understood. Okay, so this is all I want you to understand. So here, if you see in the textbook directly, it is giving, I'm reading it, muscles of the lower part of the face on the opposite side are paralyzed. ठीक है, ये देखो, अगर यहाँ पे इंजरी हुआ, then muscles of the lower part of the face on the opposite side, injury is on the right but effect is on the left, that also the lower part is affected. You're getting it? So this is what you need to know. But what about the upper part? No, upper part nothing is going to happen, क्योंकि upper part में ना there are two nerves, one is gone but one is there, right? So this is what you need to know regarding the lesion. ओके अभी ये वाला जो पिक्चर यहाँ पे मैंने जो लगाया था बेल्स पैल्सी, दिस इज नॉट रिलेटेड विद दिस, दैट इज रिलेटेड विद द इंफ्रान्यूक्लियर लीजन हियर. ओके, सो लेट अस डिस्कस अबाउट द इंफ्रान्यूक्लियर लीजन एज वेल. राइट, सो जस्ट लुक एट दिस पार्ट ओवर हियर. Infranuclear lesion, very important guys. I'll make it very easy for you to understand, just to concentrate on this. Follow the lines which I'm drawing here. Okay, follow the lines. So first let us look at this. ये देखो, just follow the line. What is happening first? Look at this red color line. ठीक है, ये देखो एक horizontal line है यहाँ पे. Let me change the color. Right, see there is a horizontal line. ठीक है, it is taking a turn and going back, coming down, okay, coming down, and again it is taking a U-turn. Just look here, horizontal line, taking a back turn, coming down and taking a U-turn. Okay, same picture I will draw and then I will explain the things. What did I tell you? ये देखो एक horizontal line, taking a turn back, coming down all the way and then taking a U-turn. ठीक है, what is this nerve? This nerve is your motor nerve, you know it. ठीक है, ये motor nerve का branches क्या है बताओ. What are the branches of motor nerve? Let us go back to the picture again. Okay, ये देखो. Right, let us look at this picture. Now we are back to this picture. Let us look at this picture over here. Now here, this is your greater petrosal nerve. Okay, this this is your motor nerve, right? This motor nerve is taking a turn like this. But remember one thing, along with this motor nerve, you even have this pink color nerve. What is this pink color nerve which I discussed already? This pink color nerve over here is a fiber that is coming from superior salivatory nucleus. You remember that, right? So we discussed superior salivatory nucleus over here in the previous class, right? So this is a fiber that is coming from superior salivatory nucleus. Now this superior salivatory nucleus fiber is giving off one branch like this. What was this? This was your greater petrosal nerve. Okay, so it means just look at this particular picture. So यहाँ पे there is a branch that is given off like this. What was this branch? This is your greater petrosal nerve. Okay, after greater petrosal nerve, what is the next important thing? ये देखो, it is taking a turn, and then it is giving another branch. What is this? This is your nerve to your stapedius muscle. Okay, so let us go back again. So here it is giving another branch like this. What is this branch? This is your stapedius. stapedius branch. Okay, nerve to stapedius. After giving nerve to stapedius, where is it going? Just see. After giving nerve to stapedius, it is entering into your stylomastoid foramen. After coming out of stylomastoid foramen, it is giving paps. I already told you paps. And it is giving branches to the muscles of facial expression, right? So let us go back again, right? Let us go back here. After that, it is entering into an opening here. This is called as your stylomastoid foramen. After that, it is giving branches. What are the three branches which it has given? PAPS, PAPS. PAPS. I'm not writing down these branches, guys, because I just now taught you the entire topic. So PAPS, but still it's okay, fine, I'll write it for you. Okay, so what is P? P is your posterior auricular branch. Next, we have got nerve to posterior belly of digastric. Okay, if you have already watched this video, then just fast forward it if you have watched the previous one. Okay, next we have got nerve to stylohyoid. So here we have got PAPS, PAPS. Next, what are these branches over here? We have got branches here. What are these branches? 3, 4, 5. What are these branches, guys? We have got zygomatic, right? And I'm just writing it as branches of facial expression. Okay, branches that are supplying to the muscles of facial expression. Okay, so these are the important things which you need to know. These are the branches which you know for two nuclei. ये देखो यहाँ पे जो न्यूक्लियस है ना, what was this nucleus? This was your proper nucleus, है ना, याद है ना, facial proper nucleus and all. And the next pink color one which I am drawing, what is this nucleus over here? This is your superior salivatory nucleus. ठीक है, सुपीरियर सलाइवेटरी न्यूक्लियस का ब्रांच है ये ग्रेटर पेट्रोसल नर्व, विच इज योर लैक्रिमल नर्व. ओके, सो आई एम नो इफ यू आर watching directly you won't understand whatever I'm talking. I'm just talking it very fastly, but if you have read that video, if you have seen that video previously and now come back here and you have come back, then it is easy for you to understand over here. Okay, right. Another important thing I told you, anterior 2/3, भूल गए? You remember, right? From your anterior 2/3 of your tongue, यहाँ से you have got a nerve. Let me write with the green. Taste sensation. What is that? That is your chorda tympani. ठीक है, ये देखो, this is your chorda tympani. This particular branch over here is your chorda tympani. Chorda tympani is going up, and finally chorda tympani will enter into which nuclei? That is your nucleus tractus solitarius. याद है ना? You remember these things, right, which I have talked previously. Now let us discuss the lesions. But again, before I discuss the lesions, यहाँ पे ना I have to do some homework over here. What is that homework is? If greater petrosal nerve is gone, what was greater petrosal nerve, guys, doing? Greater petrosal nerve will enter into your lacrimal gland, post-ganglionic you remember all those things, post-ganglionic lacrimal fibers and all, right? So greater petrosal nerve will supply your lacrimal gland. And what does it do? It will cause tear production. Okay, it will cause tear production. But if this nerve is damaged, then there is no tear production. That would result in dry eyes. That would result in what? Dry eyes. Okay, second important thing, stapedius. What does this stapedius do? Stapedius holds the stapes. ठीक है, अभी stapes ऐसा bone है, right? The ossicle stapes vibrates too much. When it vibrates, you can listen to the sound. Basically, if you are listening to me, then it is because of the stapes vibration along with the other ossicles. ठीक है, now whenever there are loud noises heard, what is happening to protect the eardrum? ये जो stapedius muscle है ना, see, simple thing, door, whatever you have, that is your stapes. You are holding the door, you are stapedius, right? Now You are holding the door so tightly that no one is coming inside, no one is able to come inside. You're getting it, right? For example, if I am paralyzed, stapedius is paralyzed, then what will happen? The door becomes loose, then everything comes inside. Everything comes inside matlab what? Sound. So even patient with stapedius paralysis, he will have hyperacusis. Hyperacusis means even if there is a small whispering that is going on, he will have very severe sound waves that are entering inside, right? He can hear it very loudly. So stapedius agar gaye, right, then the problem which the patient might have is hyperacusis. Hyperacusis. हो गया? Next, this green color branch, I name it as chorda tympani. Chorda tympani. What does this chorda tympani do? Taste. Taste के साथ साथ guys, this will also help in salivation also. Okay, just write it down. So it is responsible for both taste and salivation. Okay, next important thing is these are facial expression. Okay, these are the muscles of facial expression. Now shall we start now? The lesions over here, ये देखो, let's cut down each and everything. First, अगर यहाँ पे इंजुरी हुआ, let us say this is point A. Next, अगर यहाँ पे इंजुरी हुआ, this is point B. Okay, third is just below your stapedial branch C, and fourth is at the level of stylomastoid foramen. At the level of stylomastoid foramen. अब देखो क्या होगा. First, let us discuss about D. Okay, if D is gone, मतलब यहाँ पे अगर कुछ इंजुरी हुआ, if D is gone, then what will happen? These branches are gone, right, and these branches are also gone. It means patient will not have not have any kind of facial expression, right? So if this is on the right side, so right side facial expression gaye. If it is affected on the left side, if the cut is on the left side, then left side facial expression is gone, right? So facial expression is not contralateral, it is unilateral, it is ipsilateral. Okay, it is ipsilateral on the same side. Okay, so remember this thing. If there is a problem with the D, what will happen? First, let us say right side stylomastoid foramen है ना, वहाँ पे मुझे इंजुरी हुआ, मान लो there is an injury there. Okay, if there is an injury there, then right side posterior auricular, digastric, stylohyoid, branchiofascial, nothing will work. So right side जो face है ना, it will undergo paralysis. So left side is normal, right side is undergoing paralysis. Don't you think there will be facial asymmetry? The first important thing is there is a marked facial asymmetry. Second important thing, agar if you are not treating that, that muscles won't work. When the muscle is not working, it will undergo atrophy. So there is definitely atrophy of your facial muscles. Third important thing is that patient cannot close the eye like this. He cannot close the eye, then the eye remains all the time open. Then don't you think when the eye remains all the time open, there will be excess lacrimation? So he can't close the eye. As a result, we have got, there is increased flow of tears, increased tear flow. And next important thing is that the corner of the mouth droops downwards. I think I've kept a picture here. Yeah, just look here. What is happening? The corner, you see the corner of the mouth? The corner of the mouth has been drooped down over here, right? So there is a drooping of mouth corner. Drooping of mouth corner. And next important thing, he cannot chew. One side is not working. How do you think he'll chew with one end, right? So there will be food accumulation within the vestibule. The food accumulates in the vestibule of the mouth. So if someone is asking you what are the features of Bell's palsy, if someone is asking you what are the features of Bell's palsy, then these are the features. Is Bell's palsy contralateral or unilateral? It is on the same side, on the affected side only. If right side foramen region is affected, then right side symptoms will be seen. Okay, right side facial weakness will be seen. So these are the things at the level of D. If the problem is at the level of C, बताओ क्या होगा? If there is an injury at the level of C, you tell me what will happen. First, patient will have Bell's, मतलब facial expression is gone, all these things are gone. Along with that, chorda tympani भी affect होगा. अगर chorda tympani affect हुआ, then what will happen? There is no taste, there is no salivation. There is decreased taste, there is decreased salivation. It means a dry mouth. Patient will always have dry mouth. If there is effect at the level of B, okay, if there is effect at the level of B, बताओ क्या होगा? So you will have all this problems with the D, problem with the C, and problem with the B. What is this additional thing? Stapedius. Stapedius is gone, then patient will have hyperacusis. Okay, so hyperacusis होगा, decreased taste, decreased salivation, Bell's palsy. If there is a problem at the level of A, ठीक है, at the level of A मतलब पता कहाँ पे? This is at the level of geniculate ganglion. मैंने बताया था ना वो टर्निंग पे, geniculate ganglion. अगर geniculate ganglion पे चोट लगा, right, what is going to happen? You know guys, now B, C, D, all of them are affected. And ये देखो lacrimal gland भी affect हो जाएगा, patient will have dry eyes, dry mouth, hyperacusis and all these things. So you have to see what symptoms are asked in the paper. Okay, based upon the symptoms only you will answer this. So this is all you need to know regarding the facial nerve lesions and all. So I think this covered most of the facial nerve lesions, and regarding the facial nerve also we are completely done. So thank you so much for watching my video. Goodbye, take care, and love you all.